Thank you all for inviting me in this the wonderful event, and especially NABC, Devol Gupta, and obviously Indian physician in the USA. So all they have organized this wonderful event and invited me as a guest speaker on the wellness approach to have healthy life and avoid Alzheimer, colon cancer, and cardiac challenges. So I'm thankful that you invited me for this wonderful event and as a speaker. Now, today we are facing lots of problems, not in the USA, even in throughout the world, and the people who are joining us, not only in the USA, even in the throughout the world who are joining, they all are welcome this event. And now I am dealing with the or talking about the wellness approach to these three major challenges what the world is facing nowadays. And it is a very proud moment for myself, being an Indian, that wellness approach is the ancient history or ancient tradition or ancient culture of the India, which is deeply rooted in our culture as a wellness, even in the terms of the yoga, in the terms of the nature cure, in the terms of the Vedic tradition. So we have such wellness tradition or culture, and now that becomes the part of the medical system to take a lead role for overcoming or taking these challenges. Now, whenever we are moving towards the first disease, that is Alzheimer disease, and that the wellness management, as we all know, today is the, especially in the modern society, the Alzheimer is the burning issue. And there is the, if you summarize the disease in the short form, that is the where the brain's ability to compensate for the damage. So the all the brain's ability, whatever the brain is working regarding memory, regarding recognizing anything, so that ability is gradually damaging or gradually reducing. So lot of factors has been involved in this disease. And that factors will stimulating this disease gradually, and in the long run it makes the very challenging facing in the life. So as per the modern situation, and there is so many other factors are responsible for disease, but wellness approach has a role to take these challenges, even to compensate this or even to reduce the risk of the Alzheimer. Now, though, if you go for the only one thing first, that is the exercise. So, exercise is the single most powerful intervention in this disease. Aerobic activity, which includes brisk walking, cycling, swimming, especially for the 130 to 150 minutes per week, increases our hippocampal volume by 2%. And that uh, simple exercise or that approach directly counteracting the Alzheimer related damage to us. So the exercise, especially the aerobic activity, has a directly role to countering the Alzheimer related shrinkage. Even the the mechanism which we have, the BDNF, the brain derived neurotropic factors, so which acts as a fertilizer for the neurons. And one study had been conducted in the 2011 by the erection. It confirms that the structural brain changes in the randomized controlled trial in this situation. So it is the, even the next we go for the point, for the diet, mind diet. It combines basically the elements of the Mediterranean and DAS eating patterns. Key protective foods include blueberries, leafy greens, especially which contains the vitamin K, folate, and lutein. Even the nuts which include which contains the vitamin E, olive oil, and the fish which contains the omega 3. So these, there is a different study shows that this type of diet has a directly approach to reduce or to take the challenges of the Alzheimer. So the patient having or suffering from the Alzheimer, their such diet may take a lead role to counteract the that is the your Alzheimer game. Another factor, that is the sleep. Sleep has a crucial role especially though that factor has not been considered or thought very properly. But as per modern medicine, it has been said that during deep sleep, that is the NREM, usually the detoxification you say, or the brain's waste clearance network is the 10 time more becomes active during the with the deep sleep. Now, one another things though, what we the Indian point of view or the wellness concern of the Indian point of view, it thinks what the today the modern science use the word circadian rhythm, but in the Indian concept already dincharya or ritucharya is always the part of their lifestyles, even the part of the traditional medical system. So that is the also important at what time you are going to sleep and what time you get up from your bed. So that is the also circadian rhythm is a very important. So better to go sleep after 10 or within the 11 and get up within 5 to 6 a.m. So that is the this is the year. Now, when we go for the that is the because it directly involved with your cognitive function, where whenever the person get the problem with the or facing the challenges of the Alzheimer, so they have got the cognitive challenges. So cognitive challenges is because a person faces the cognitive challenges, and so there is a lot of things we may introduce to go for the cognitive work, like learning a new language, playing a musical instrument, so or involved in the such task where the mental or cognitive activity, or especially where neural pathway is uh, directly or indirectly stimulated. So if you go for the such type of activity, that becomes obviously get a better option for the Alzheimer patient. So, and another now, when we go further, that is the whatever we discuss about the exercise or the diet, sleep, and the cognitive activity, whatever you we may. Even in Indian culture, we always talk like chess or something else. But anyway, we may go for the any option for to go for the neural pathway. Now the next one is the, though it is also the part of the wellness, but I'm going to discuss it differently for the yoga. Yoga, as we use the word yoga, but exact word is the yoga. So whenever you go for the yoga, it has a diverse and most effective role in the Alzheimer countering or taking care of the Alzheimer patient. So if you go for the yoga therapy as a therapy or therapeutic approach of the yoga, so first the proposed mechanism what yoga play, that is mainly it reduce the sympathetic nervous system activity. So it is a very important key to reduce the sympathetic nervous system and enhance the parasympathetic vagal tone. It lowers the cortisol level. That means the patient will the stress level will be the reduced, and patient mentally becomes the calm. It improves cerebral circulation, though that is the most important thing when we go for the yoga, and it improve the cerebral circulation. So it you provide proper oxygen, proper nutrition to the brain tissue, also, or proper circulation to the brain tissue. So yoga play a major role for the improving cerebral circulation. Even it is very helpful. Yoga is very helpful to reduce the systemic inflammation, improves the balance and flexibility. Obviously, it also improves the mood and sleep, which is the one important factor for the Alzheimer. Yeah. And it also it promote mindfulness and emotional regulation, because in Alzheimer today we are most persons, if you go for the study or you are getting or facing any Alzheimer, most of the patient feeling with the or the suffering from the depression or loneliness, so or emotional setback, that may lead towards the Alzheimer or something the dementia problem. So yoga promotes that emotional regulation, that will be the helpful to the helpful for the such patient who are suffering from the Alzheimer. Now another one part, that is the part of the yoga, though we are today in consideration whenever we talk about the yoga, generally we thinking about you asana, uh, then after that pranayam, and obviously we then third go for the generally meditation. But when we details we going for the yoga therapy, yoga as a system. So if you go as for the Patanjali, that is Ashtanga yoga. So before asana you have to yam and niyam. That is also important, because whenever you go for the yam, so the yam process, process of the yam where you Satya Ahimsa, that is the truthfulness, non-violence, whatever you are thinking, that is the way for the cognitive exercise or cognitive function. There is a lot of things, so that is also important. But anyway, after the that is the yoga therapy where we go. So there is the one pranayam, whatever, though we use toward the breathing exercise, but generally, as you know, breathing is the involuntary process and pranayam is the voluntary process. So there is the basic difference between the breathing and pranayam. Breathing is involuntary, going on. But whenever you go for the pranayam, you have to try, or voluntary you have to do for the pranayam, because there is the process when you take inhale, you retain, and then you exhale. So it is the voluntary process. And there is a difference type of pranayam. One we usually say the dirgha swasa, that is the deep diaphragmic breathing, where you take the deep inhalation, where diaphragm of the abdomen will, you suppress as much you create the pressure, it goes to the just up to your extent, up to what level you can suppress or you pressurize the diaphragm. So there will be the deep breathing. Another is the anulom vilom, where we get start with the left nostrils, then we release with the right nostrils. Again, we will take the from the right nostrils and release with the left nostril. That is the one cycle, and it we will repeat in the same and same. Another is the Brahmari, that is the humming sound of the humming sound with the breathing or with the pranayam. So that is the most important when we go for the humming sound, and we gradually that sound vibration which creates. As we know, there is a lot of modern science also say whenever we go for the, especially when we move for the delta wave, if the body or person brings in the delta wave, the body go in the auto healing mode. So Brahmari pranayam, gradually your brain vibration, it alters the vibration in the such mode that it might go in the by it may moves towards the delta waves, and such pranayam, and body moves towards the auto healing or auto correction mode. So that is the other. Another is the Shatkarma, though Kapalbhati, lots of people used to say it is a part of pranayam, but as per classical text, Kapalbhati is the Shatkarma, that means the process of the detoxification. So, Bhastrika is the pranayam, which is the forceful exhalation, followed by the passive inspiration. So, if the person is the older age, be careful whenever you go for the Kapalbhati or the Bhastrika, be careful, especially if the older patient. So be careful. Another, meditation. Obviously, if you go for the classical test, there is the Dharana, Dhyan, Samadhi, three step of the different way of the going for the meditation. But generally, we use the word terms in the English, the meditation. So there is a different part when we go for the meditation. In meditation, we start with the one with the mindful meditation. One, we correlate with our breathing awareness or our breath pattern, awareness with the breath pattern, and then that will indirectly lead to the mental control, and then we gradually we go for the meditation level. So whenever we move for the meditation, obviously it is the very effective for the cognitive function. It reduces the stress, improve attention and focus, better emotional regulation, and obviously it enhances the quality of life. And one another very interesting or very important and powerful things what the yoga tradition has, that we are used to say the yoga nidra. So it is the guided relaxation practice that may improve your sleep quality, anxiety, stress perception, daytime well-being, as well as your cognitive function, because yoga nidra might not might but may continue or may affect the cognitive function in the passive way, whatever the in yoga during the process of yoga nidra, suggestive guidance will be stored in a memory or as a subconscious level. So yoga nidra may take a lead role or very good effective role in the process of Alzheimer control. Now, another part what we are dealing with the colon cancer and that wellness management of the colon cancer, especially is the colorectal cancer. That is the especially it occurs at least minimum history of 10 to 15 years. Then it uh, convert as a or manifest as a colon cancer or colorectal cancer. So wellness approach has a good role to prevent it or prevent as a preventive intervention. And whenever we go for the such preventive intervention for the colon cancer, first we move for the first the point which is very important is the dietary fiber. So dietary fiber is the very evidence, even it has been the evidence that it has take a very important factors to reduce your colorectal cancer, because it generally uh, it speeds up the intestinal transit intestinal transit, which generally even that includes the carcinogen contact time. So whenever it intestinal transit speed ups it, and it is fermented by the gut bacteria into short chain by fatty acid and with the like vitriol, and that is the butyrate is the preferred fuel of colonocytes or that potent inducer of the cancer cell. That means the factors or the cancer cell which are the which lead to the colorectal cancer. So butyrate, which is the uh, produced by the fermentation caused by the fiber, and that butyrate is the preferred fuel for the colonocytes, and gradually it reduces the cancer cell. And there is a lot of study, even European study has conducted even more than 5 lakhs people, and that the higher the person who take the highest fiber uh, diet or the group which consume the higher fiber had a 25% of the lower cancer risk. So number one, we are dealing whenever we go for the colon cancer, we must be the our diet must be with the fiber rich. Second, with the physical activity. Obviously, physical activity reduce such a risk of the cancer by reducing the insulin level. It lowers the prostaglandin and faster the bowel transit. So that is the main factor. If your bowel is not properly clear and the stool or the waste product are storing for the longer duration in the wall, it is the one of the factors. So physical exercise gradually help in the you're controlling the reducing the insulin level, lowering the prostaglandin, and obviously the speed up the bowel transit. So this is the more factors, important factor in the one. Next, uh, generally red meat or processed meat, it is the one of the important or very uh, effective factors for occurring or for promoting the that is the colon cancer. The better we should avoid such type of this, or the person who have or who have tendency or who have the problem or history of the such type of the disease or problem. So better to reduce. This is the one of the major factors for the your colon cancer. The gut microbiome, as we all know today, the gut microbiome is the one of the emerging frontier or emerging factors for the your gut health and reducing or countering the colon tumors. So it is better to go for the diverse and plant-rich microbiome that generate more butyrate and supports immune surveillance. So better to go with the plant-rich microbiome which create more nutrients and supports our immune surveillance and gradually fight or reduce the harmful bacteria. So this is the very important for our colon cancer countering or taking care of the. Now when we again go for the non-medicinal treatment or non-medicinal approach, wellness approach, yoga is the very integrated and supportive uh, role in the this cancer care. Is first, it reduced the fatigue, it improved sleep, it reduced anxiety, better flexibility, enhanced quality of life, improved emotional well-being. So this is the very important factors, important role of the yoga, and which can directly support in the integrated way to countering the your cancer, colorectal cancer. Now, when we for the pranayam, obviously pranayam, there is the diaphragmatic breathing where you use the diaphragm properly up and down, so which will help for the colon movement and circulation, improving the circulation of the colon and better to uh, help to expel out the waste product. Sectional breathing is the very important whenever you take from the low, breathing from the lower chest, middle chest or upper chest. That is the very important. Anulom Vilom is a very important where you can it is a better way of to detoxify the body, not only the colon but each and every part of the body. So Anulom Vilom is the one of the very uh, proper and very effective pranayam which takes the good role for the countering. Meditation again, it reduces the stress, anxiety, depression and fear of recurrence. Yog Nidra, obviously Yog Nidra basically do here with the sleep quality, relaxation and psychological well-being, because that colorectal system as it involves with the your colon, so obviously there is the gut brain axis and it directly or indirectly affect the your mental and emotional well-being or psychological well-being will be affected. So Yog Nidra is directly go for the psychological, dealing with the psychological well-being. So better psychosomatic way approach of the taking care of this disease. So Yog Nidra will be the very effective for that. Now the third part, which is the very important, another again the cardiac disease, various cardiac diseases, and that wellness approach. So fundamentally, if you go for the cardiovascular disease, so today is the more problem begin with the atherosclerosis, that means the plaques in the arterial chain. So and that leads to the hypertension, insulin resistance, inflammation and endothelial dysfunction. So they are all, but all this disease or all disease disorders, actually if you think, it will not, it is not a disease, it is the exactly the modified by modified abnormality or modified disorder due to your lifestyle irregularities. So it can be modified again or it can be changed by your lifestyle. So there is a lot of these things. So you deal with the lifestyle problem, because this disease is the most of the this part is the due to only lifestyle disorder. So better first we go or deal with the, obviously the diet is the very important, and there is the a lot of study has been conducted that this the, if you providing the virgin olive oil to the patient, it reduces the heart attacks, strokes and other cardiovascular death by approximately 30% of the total uh, death. So it's good to use the olive oil. Omega 3 fatty acid, that is that we usually get from the fish, it reduces the triglycerides and obviously stabilize the our cardiac electrical stability. So better if you go for that first whatever the cardiac disease, if you first start with our diet regulation or thinking about diet, what we are taking before suffering of this disease, and that change will be the, and how that change affect your lifestyle. So first start with your diet, and that diet first you use the virgin olive oil. Obviously, use omega 3 fatty acid. That will be the obviously effect. Even when we go for the regime diet, it also reduce our hypertension. uh, there is the so diet is the very important, where we go for the either you use the virgin olive oil, omega 3 fatty acid, and that gradually your affect not only your cardiac electrical stimulity, but it reduce 8 to 12 or 14 millimeter of your systolic blood pressure, what we generally such result we usually get by the any anti-hypertensive medication. So that if you go for the proper diet, it works as equivalent to such medicine, anti-hypertensive medicine. So this is the very important, because if our diet contains especially high potassium, which generally promotes the sodium excretion, and magnesium helps for the vasodilation, so that will help for the your reduction of the yeah, or regulation of the blood pressure, and also reduces your LDL cholesterol. So better if you go for the diet with the potassium, which reduce sodium excretion, magnesium which vasodilate, and again gradually it help in the in this way it reduce your various cardiac problem, or regulate various cardiac function in the normal way. Exercise, as we all know, that is a bit one of the major and key factors for the providing benefit to the cardiovascular uh, patient. So it generally, if the proper exercise reduces the heart rate, or resting heart rate reduces, lower the blood pressure obviously, endothelial nitric oxide will be the increase. That means the endothelial nitric oxide production will be the generally improved, so which makes the blood vessels more flexible. It raises the HDL cholesterol and reduce the inflammatory markers. So better, it is the very important. If you go for the exercise, it go for the so various, from the heart rate to the blood pressure to the blood vessels flexibility and HDL cholesterol. And even as one study shows, though walking 75 minutes per week will reduce the cardiovascular mortality by 20%. It is a study has been already published in the JAMA Internal Medicine 2015. Stress directly influence our cardiovascular problems. So it is one of the major risk factor for the not indirectly, the directly one of the major factor for the cardiovascular uh, problem. So chronic psychological stress activates the HP axis, and which elevate the cortisol levels, and gradually raises the blood pressure, platelet aggregation, and obviously increase or promotes the endothelial inflammation. So in there obviously lots of problem is the creating. So better we go for the other mechanism which directly regulate, influence, or reduce the stress level. So that will be the helpful for reducing our cardiac problem. And whenever we think about the stress regulation, already we have discussed in the previous two topics, that is the yoga, meditation, and pranayam has directly role to regulate your stress, control your stress, and your total emotional regulation. So if now we are going for the all three condition, and commonly we are consider, because all three disorder is obviously is one of the major part is the lifestyle disorder. Even the Alzheimer also, there is the lifestyle disorder, obviously other factors too, but whenever we move summarize with all the three condition. So first we think about the move daily, that is the aerobic exercise is the protective across all three. So better So aerobic exercise, whatever you can, or whatever the your caregivers can give. So it's better eat plants, because you know it's fiber, you need antioxidant, you need anti-inflammatory compounds from whole seeds or whole food. So eat plants, sleep well. And one thing I always used to say, ki not only sleep well, sleep at time. Know your body's circadian rhythm, because disturbing or disorienting your circadian rhythm is also one of the major factors to disturb your lifestyle disorder. So circadian rhythm or dincharya or ritucharya, better to go further. So sleep well, you know your sleep, not only just only to go and close eyes. That sleep must be restorative, must be refreshing, must be refreshing to your brain, your immune system, and obviously your vascular system. So it is very important. And whenever eating, one more thing I add, where eat the seasonal things. What the season produce, you eat that fruit in that season. Don't go for the preservative food. Next, manage your stress. Learn to manage stress or learn to overcome the stress. So that is the, because don't take your stress in the chronic level. Just take it and avoid it, or it overcome. Don't smoke. Though here the say the limit alcohol, but I would prefer don't smoke and even avoid the alcohol. Now, the another part of the wellness, that is the naturopathic support or the nature cure support. So your nutrition must be the balanced, regular physical activity, safe sun exposure. That means you must need the sun bath. It is very important, because it's lots of factor. If you need the vitamin D, this is the safest and the one of the most effective way to get the vitamin D, and that vitamin D will be helpful to the for the calcium absorption. So sun exposure proper, obviously under supervision, in which way you can take a sun bath. So better go under expert naturopathic physician or wellness consultant. So uh, uh, go for the sun exposure, adequate hydration. Even the drinking of water will be taken key at what time, up to what limit you can take a water at a time. So that all should be, you get under the supervision. They will guide key as per your need, how much water you can take at a time. That will be the very important. So adequate hydration important. Reduction of the stress is very much essential. So you go for the our nature exposure. Nature exposure meant, being a human being, we all are the product of the nature or the part of the nature. So nature exposure or connection of the or contact with the nature, that will help for the your psychological and emotional balance, and dealing with the help you to better fight for such disease. So and healthy daily routines is the very important. Hydrotherapy is very important. Hydrotherapy may improve muscle relaxation, circulation, joint mobility, stress reduction. So these are the factors you can this, and these are the all whatever I discussed. There is a lot of things here. The scientific evidence here, the given what study has been conducted in the various study. For few of the such scientific evidence resource materials already I have put here. You may go through this, and whenever you go this with the practical yoga session, whenever you go, it's better to 30 to 40 minutes, gradually increase and go up to 30 to 40 minutes. And you deal with the various component, divide it in the various component and deal with the patient with that way. That is the first part, or first approach will be the centering and relaxation, that is the 3 to 5 minutes. Gentle joint movement 5 minutes. After that, standing and the sitting asanas, so that will be the 10 to 15 minutes. Slow breathing and then gradually go for the pranayam. So start with the slow breathing and gradually, that means slow breathing, no normal breathing, that is the involuntary, and then gradually move towards the voluntary control of the breathing, that is the pranayam. So that will be the 10 minutes, and after that go for the meditation, that will be the 5 minutes, and after completing these all things, go for the Savasana, 5 to 10 minutes. Shavasana looks like a easy posture, but it is the really, you believe me, it is the toughest asana, because Shavasana means you lie down like a dead body. That is the really difficult. Being alive and lie down like a dead body is difficult. That means in Shavasana you lie down in this way that your all the senses will be the detached from all things of the worldly attachment. Then you go for the Savasana, that will be the very important. So if you go with this, that will be the Yoho. And so that is all about me. So thank you all of you for listening me and supporting me, and thank you all. See you again in the next event in next part of the globe, in anywhere others. I'm working here in the India for the in the wellness industry, wellness corp. So thank you all, and again I thanks the organizer. Thank you, thank you all.